changes that happen during the pregnancy period after the birth, they tend to break down. Yeah.
How long does this happen for the women?
How long or how often?
How long? Like if they get into postpartum mental stress or mental health.
How long does it stay with them?
How long does it stay with them?
Okay.
So it's according to the severity. We have the baby blues. That is within 1 or 2 weeks it should wear off. Maybe after birth, because of the pain and all of that, I'll be anxious, I'll be sad, crying spells, and then thinking about how, even if I'm a first mom, how I'm going to take care of my baby and parenting as a whole. So within that one, by 1 to 2 weeks, it should be fine. But there are severity. So we have the postpartum depression. It turns out to be the psychosis. For the psychosis, it can be with the person 2 to 4 weeks. That is where you realize that no, the person has to seek help. So you realize the person will be showing some symptoms like hallucinating, talking to themselves, avoiding the baby, finding it difficult to bond with babies, and finding it difficult to relate with.
So would you say those are some of the reasons why some newborn mothers will kill the baby or throw it away?
So this morning I was going to share a story, but it escaped me. You know, I tell you about this old lady that I often lift to work. And on our way, then she told me that, something happened yesterday around where we live, our area. There's this girl who had given birth to a baby girl. The baby girl is only 3 months old. And then she went to the KATH cemetery and dumped the baby there and covered the baby, with plantain leaves. And apparently even attempted to burn the baby unsuccessfully. So when she was going towards the cemetery, somebody who was selling nearby saw her with the baby. Upon her return, she was alone. So this woman asked this this girl, where's the baby? And according to information, the response she gave was that, but not come madam for be. And then they were like, so they kept, kept pushing. And then they called, there's a police station nearby, the KATH area. So they called the police personnel. They interrogated her, and then they realized that she had attempted to kill the baby just yesterday afternoon. So she's been arrested, actually. So it's all part of the postpartum thing you're talking about.
So I think that there's someone like that shouldn't be kept in the police custody. We should seek help for the person. She might be going
psychological help.
Yeah, she needs psychological help. Maybe like I said, the hormonal changes. Maybe the support from the husband or the man who got her impregnated is not available. And maybe she's struggling, maybe financially or something else. So all of that coming together can make her have those thoughts. So we shouldn't think that she's trying to kill the baby, so she's committed a crime. Let's seek help.
But that is criminal as well. I appreciate where you're coming from. You're a health expert, so let's stick to that one. But Dr. Tete, these symptoms that she talks about, how easily identifiable are they, and how preventable are they?
Which specific symptoms?
So she raised a couple of them. Okay. You yourself raised a few of them as well. So I just want us to look at it from the broad perspective. Are there some that can be easily identified? Are there some that can be prevented so we don't get to have those mental health challenges? Because, for example, the one with the pregnancy, the pain definitely will come. So how do you manage that? Is it through painkillers? I mean, the postpartum thing she talks about, you're not able to bond with your children or your child. I mean, all those things. Plus the stresses that we have in our society. Work stress, family stress, financial stress. How do we manage them? How do we prevent them, if possible?
All right. So first and foremost, the postpartum blues she mentioned, like the crying spells and then all that. So it's very common in newborn mothers, like she said. And then... But it doesn't last for long. A week or two, it should go away. So therefore, if it persists for a longer time, in the 3rd week, 4th week, the person is crying, constantly crying, and then it means that the person should have to seek help. Some of the symptoms are very difficult to notice. For instance, if somebody is hallucinating, you are hearing voices or you are seeing things that are not there. It will be very difficult for you to notice unless the person tells you. So it means that we have to be in constant communication with our close friends, especially the husbands will have to be there. So the support is very important. You'd have to constantly ask them, are you experiencing any issues? Are you having issues bonding with the baby? Are you...
Who should be asking the husband?
Anybody who...
And oftentimes, they bring their mothers in or some elderly persons in to help. So those persons should be asking those questions.
Should be asking and then, be observing them for any changes.
Well,
okay.
In this day and age, if a man is with a woman and then she starts saying these things, won't they run away and leave her?
That's why the education is required. That's why the education is required.
So, I mean, the knowledge is very important. So let us all be aware of these things, and then when we see them, we can pick them up quickly.
But how well are they themselves able to manage the situation? How well are they able to cope with the situation? I'm talking about the stresses, not just the women, but all of us who are having challenges with mental health issues. How well are we able to manage the situation, and what impact is it having on us? Okay,
so I would say to a large extent that a lot of times. I mean, some of us are able to, manage some of these stresses. For instance, if I've taken up a lot of jobs, maybe I go to Konfanochi, I go to another place, at a point, my sleep pattern is disturbed. I'm not functioning well as I'm supposed to. Then I decide that, let me cut off some of these things and then maybe focus on one or two at a time. So the workload at a particular time is very, 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 very important. I think, yes. So that's...
Abigail, is there anything you want to add?
Yeah, so if I think I'm stressed and at a point in time I can't handle it myself.
Especially when it comes to financial stress, like the situation that I find myself in right now. And the thing is stressing me.
So something like this, I have to talk to someone. I have to confide in someone I think I trust, or maybe someone who can actually offer me help. Sometimes if I need money, it's not only about me getting the money that help me manage my stress. Sometimes you need someone to encourage you, you need someone to talk to, you need someone to confide in, so that you can tend to release the stresses, because your ability to cope with stresses determines your mental health status. If you are a mentally healthy individual, you should be able to cope with stresses of life, because our daily stresses, someone can get a broken heart and tend to break down and be brought to the facility to be seen. Another person will go through same and just cry out and say, let me move on.
But isn't it because of the fact that we're differently wired? You can handle something, I cannot handle it. You're different from me. So we cannot necessarily conclude and say that you are doing better than the other person. So we know, again, when it comes to mental health issues, there's a lot of stigma attached to it. I don't know how well we're managing the stigmatization in Ghana, but the people around us, how well are they able to handle or manage the situation we find ourselves in? Are they able to do a good job?
People around us.
So, for example, he is stressed. Okay. He has challenges. I'm around him. Do I understand what he's going through and lend the right support to him, or I make his situation worse because maybe I'm adding on to the problem that he's already having? Maybe it could be work issues, and I'm stressing him some more. I don't know whether my question is clear.
Yeah.
Do you understand my question? It could be in the home. So the wife who just gave birth is acting in a certain way. The man who's supposed to understand the situation the woman is in and lend a bit of support, is the man understanding the woman? Is the man giving the right support, or the man is even worsening the situation? Those are the things I'm asking. So people around, people who themselves are having these challenges, the mental issues, the people around them, are they giving them the right support? Are they understanding them and helping?
Okay, so some are doing actually well. Because of knowledge, like we are saying, is all awareness. If I don't know if something is going on and I don't know anything about it, I wouldn't know how to handle the situation. So people are actually doing well. People are living with mothers or fathers or husbands or wives with such challenges, even children with such challenges. So since they are aware, they are doing well. But sometimes too, we are not doing well because we are not aware of what is going on. So that is why we are here to create the awareness. If I'm a colleague of mine, I've been observing some changes from the person for a while now, I should be able to talk to the person.
All right. So to add on to what she said, a lot of times some people have. So like I think you mentioned something about person A being able to cope with stress as well
better than the other person.
So some people have a predisposition to a particular condition based on their family history. So if, for instance, my father has a mental health disorder, maybe a mood disorder like depression or bipolar or schizophrenia, there's like a 50 to 70% chance that I may develop that particular condition. So being aware of that, because there are triggers. I may have a genetic predisposition to a particular condition, but I may not. It's not everybody who will express. It's based on your, social circumstances. For instance, if I'm from a family of, let's say, I have 3 siblings, and we are all raised in different environmental conditions. Let's say my sibling A is raised in the UK, I'm raised in Ghana, for instance. The same social conditions that my parents came out from. If I also, come from the same social circumstances, it's very likely that I may develop their mental health condition, as opposed to somebody who grew up probably in England or so. So the parents being aware of this should be the ones to give a lot of support to their children when they give birth. For instance, after birth, the stress actually increases because there's a new baby you have to take care of. You have to think about how to bond with the baby.
Even provide for the baby is not an easy thing.
Provide for the baby, changing diapers here and there, and all that. So the stress is a lot, compound. So they need a lot of support from the husband, from the family, everyone.
So you know what? When people are stressed, people tend to fall on so many things to manage the stress.
Okay.
So there are people who take a amount of substances. There are people who maybe take alcohol. There are people who take some medications just to be able to manage their stress and have some mental health, very good mental health well-being. I mentioned the issue in traffic, where somebody will drive carelessly under normal circumstances. We all sometimes are careless on our roads. Yeah. So you should be able to, harbor it and just move on. But the insults and the exchange from the other person sometimes escalates. Even in compound houses, there are people who are neighbors and yet they're at each other's neck, fighting, harming each other and all that. What I'm driving at is this: with all the challenges that we're faced with all the stress situations, what strategies can individuals use to maintain good mental health? What are the strategies? What do we need to do?
Okay, so so you are looking at the